When we were in Nigeria, we were the witnesses to the difficulties and perinatal mortality in Igboland that reflects, even today, Nigeria's wider maternal and infant health challenges, with rates in the region reported being between 40 to 60 per 1,000 live births in hospital studies. And this is just for the hospital, but obviously many women then uh, deliver their children at home or in local maternities that were manned by experimented midwives who unfortunately did not often benefit from specialist equipment and couldn't take care of complications. And that resulted in many babies being you know, dying within hours from their birth. We were witness to one of them. The grandma announced proudly that the, the daughter had given birth, and then within 30 minutes, she ran back to say that the baby had died. Some other people, many of them, never reached the hospital. When they try to reach the hospital because there is a problem with the birth that was not anticipated because many people never attend prenatal classes or appointments. They end up going to the university teaching hospital in Enugu in the region. And then you have to pay the hospital fees. And such a lady was there one day when I was giving birth myself. And she arrived at the gate, and while they were telling her to pay, she died. And that was a terrible thing to happen that day. Everybody was talking about it. So the orphanage was a good thing because apart from perinatal death concerning the children, many women die in childbirth in Nigeria due to many factors, especially the lack of prenatal care, the problem with paying exorbitant hospital fees, being far from the hospital during birth time, and or sepsis sometimes after cesarean section. So when the babies are orphaned from their mom, then they go to the orphanage if the fathers cannot cope with them. And they stay there for 2, 3 years before the family comes to take them back. And when we were at Nsukka, the women manning the children's center on campus, that were mostly Niger wives, organized a trip for their children, for the children from campus. They were going with a bus once a week to the orphanage and playing with the orphans there, taking them out of their cots, playing with them, helping with changing their diapers, feeding them, but mainly playing with them, which was very good for those kids that lacked activities. And we are grateful for the fact that our children could share in that experience of giving some of their time, as young as they were, to others.